The following information is for informational purposes only and is not intended to be used in place of a medical provider. Please seek advice from your medical provider, who will be able to tell you what is best for your personal health conditions. Medications can be very confusing. The names alone are difficult to pronounce, much less to remember. Because of this, many people don't know exactly what medications they are taking, why they are taking them, or other details of how to take them properly. However, it is vital to your health to know exactly what medications you take and how to take them as prescribed. Why is it so important to know your medications? Because they all have side effects. Because some medications must be taken at certain times of day in order to have the best effect. Because some medications should be taken either with food or on an empty stomach. And because some medications can be very harmful if stopped abruptly without tapering the dose. Hopefully this video will help you know your medication details in order to achieve your optimum health. Here is an example of a spreadsheet for organizing your medications. We recommend that you copy this spreadsheet and fill in your medical information. In the first column, you will see the medication name. Note that there is typically a trade name and a generic name for each medication. In the second column, you'll see the dose of the medication. In the third column, you see the quantity of the medication. Make sure to know how many individual medication doses you are to take. Next, you see the route of medication intake. Most medication is taken by mouth, which is abbreviated PO. Next, you will see the frequency column. Make sure you know how often you take your medication and at what time of day, which is noted in the following column. The second to last column is important. Make sure you know the indication for taking your medication. Know what medical conditions you have and how they are being managed. Finally, utilize the notes column for specific instructions that your medical provider may give you. The task of learning your medications can be very overwhelming. Fill out the spreadsheet to the best of your ability and feel free to call your provider and make an appointment with him or her or their ancillary staff if you need further help filling out the spreadsheet. Make sure to take in your collection of medication bottles or vials at that appointment.